Hi, this is Julie Lubinsky, and I'd like to welcome you all to this month's edition of Ask Nurse Linda. Linda is a leader, teacher, and a provider of rehabilitation nursing for over 30 years. And in fact, Nurse Linda worked closely with Christopher Reeve on his recovery and has been advocating for the Reeve Foundation ever since. We will start off the discussion today talking about ways to increase your function such as FES, and I'm going to turn it over to Linda now. Hi, Linda.
Hi, Julie. Thanks so much. It's so nice to be here with you again this afternoon. The weather's starting to turn chilly, so I hope that everybody's staying warm when we have those temperature changes. You know, it's always a difficult time to adjust our body temperatures. But today we're going to be talking about increasing function. And so the blogs this past month have been on various ways to do that, starting with everything from how the nerves transmit signals to how FES works, and moving into even how you can use automatic reflexes to increase your function, as well as to increase your function by hiring an attendant or finding someone to help you become more mobile and more functional. So we're of course open to all sorts of questions, but we have a very good question to start out this talk today, and that's regarding the status of T-cell therapy in regenerating nerve tissue. And so this is a very interesting question because there are always a lot of different therapies that come up that people have an idea that maybe it will work for spinal cord injury because it's worked in another type of treatment. So T cells are found in the body, and they help with the development of antibodies. And so they're a natural substance in the body that is being used by your body for all sorts of things. But the T-cell therapy has been used a lot. It's been likened to stem cell therapy, and it has been used a lot in treating different cancers, in leukemia, metastatic lung cancer, various different types of cancer, and especially it has been used in pediatric cancers. So the idea is that they grow some T cells in the laboratory. Now, different places do it in different ways. Some will generate T cells through chemical processes, and some will take some T cells from your own body and then multiply them in the laboratory and then give them back to you. So will they help with spinal cord injury? Well, there are some people who say that it will help. Right now it's not in the mainstream of treating spinal cord injury. So I would never say that something wouldn't help, but right now there's not much evidence to say that T-cell therapy would help. It certainly helps in cancer, and you could, in treatment of cancer, and you could extrapolate that in your mind that if you need more antibodies in your body, that T cells would help in treating of cancer, maybe even some sort of infections. So the idea of that you loaded your body with T cells, would that do something to affect your spinal cord injury? Well, I suppose on a molecular level there might be some possibility of that, but there's not really hard and fast evidence. Now maybe next month we'll read a published study that has come out, and this has turned out to be a good treatment. But as of right this minute, I don't know of any studies that indicate that is. A lot of this T-cell therapy is being done in the country of Panama. And so sometimes when experimentation is being done in other countries, it's being done there because they're not following the FDA guidelines. The FDA guidelines are sets of rules established by the United States government for doing research and that sort of thing. So they're very strict rules, and some people think, well, that's really great because we want to protect the population from people doing experimentation that might not have a good scientific foundation. On the other hand, people say, well, there's some therapies out there and we need to get them faster into the common treatment place, and so the FDA kind of hinders us in that way. So both are very valid arguments, and of course somewhere in the middle lies the reality of how these things work. So on the T-cell issue, I think maybe we need to wait and see what that is going to turn out to be. But there are a lot of people who undergo many different therapies in hopes of finding treatment. Right now there are so many treatments that are being developed scientifically in the United States, but also in other countries that are having very successful results. The T-cell treatment kind of makes me think of the shark cell treatment that was being developed in Mexico about 10 years ago, and that was really hot in the community for people with paralysis. And so people were going down to Mexico and having these shark stem cells injected in along, not in their spinal cord, but alongside of the spinal cord, hoping that the cells would generate some kind of return of function. And some people actually did get some return of function, but it was not sustainable, and it was very, very small amounts of return of function. So it would lead you to believe, as a scientific researcher, it would lead you to believe that perhaps people had that function but didn't know they had it, and so maybe they hadn't been challenged to use those muscles or to move those particular limbs or to have their sensations. So, I think the jury is still out on the T cells, so we'll have to see. Now, you probably have a lot more information from your doctor that is advocating the T cells, so I think those are just good questions to ask the doctor about. Is it being done here in the United States, or will he be getting his product from Panama, or how are the T cells generated, and then what evidence does he have that there might be some success? The worry that we have, and another very important question would be, who is sponsoring this particular research? Because if it's a private development company, it might be more financially motivated than cure motivated. Now, I'm not saying that any of that is happening within this particular treatment, but it's not in the common possibilities that we're hearing about right now. So there's another question that's coming up about FES being a restorative therapy for SCI, and the question is, with having an incomplete spinal cord injury, will it hurt? Well, the way FES, functional electrical stimulation, works, and I think the operative word here is electrical. So it's an electrical stimulation that's applied to the body that causes a functional movement. So that's where we get the name FES. So what happens is the electrical stimulation can come in two ways. Now, it can come as an electrode, like when you have heart monitor test, when they do an EKG and they put those little pads on your chest, they're measuring the electricity component, the amount of productivity of your heart. So that's coming from inside the body. When we do FES on people with spinal cord injury, we're putting electrodes on their legs, on their arms, on their trunk. Sometimes they're externally placed on the skin, and sometimes they're internally placed, and they piggyback on a nerve to make that nerve contract and relax, so in a rhythmic pattern, so you get some function. So if you have sensation, this definitely is going to be an electrical shock that you are going to feel. If you don't have sensation, you won't feel the shock, and so it's easier for people to tolerate the therapy. So if if you are having functional electrical stimulation therapy and you have sensation, it is oftentimes very difficult to tolerate that type of therapy. Because you're going to feel, if you think about, your finger gets near the electrical outlet or you get a shock from an electrical appliance, that is what it's going to feel like. It's not a pleasant experience, and it's not something that you can even try to tough it through or tolerate because it's just too unpleasant, and it's not really helping you if it's causing that much pain. Now, sometimes on the internally implanted devices, those that are put inside the body and worn inside the skin, those will be put on nerves that are motor nerves that don't carry the sensations. So inside our body we have nerves for motor power, making our body work and move, and we have nerves that are for sensation that carry those pain signals back and forth to the brain. So when we are able to put an FES device inside the body, the surgeon will be very careful to attach it to a motor nerve as opposed to a sensory nerve, so you don't get that overlay. So if you are incomplete, can you have this treatment? Well, it does have this pain component to it. Sometimes they can dial down the electrical stimulation to a current where people can tolerate it. Most often what will happen is if you're incomplete, you might not be able to tolerate the electrical stimulation, but you can still very much take part in the repetitive movement parts of those therapies. So if you think about the most popular FES therapy that we have for paralysis is bicycling and stimulating the legs to move. It's a very beneficial therapy to have because the muscles in the legs are so huge, and as those muscles are being worked, we get a lot of benefits. We can build up the muscles, make them stronger, help protect us from skin breakdown. And you can do that through repetitive movement if you have an upper motor neuron injury, so the kind that accepts either electrical stimulation or the repetitive movement. And the other thing is also stimulating those muscles and utilizing those muscles either electrically or just with a repetitive movement helps reduce your chances of developing diabetes because those big muscles are being exercised. And that's one of the key factors in using your muscles. And so if we grab onto the biggest muscles in your body and work them, that helps metabolize that glucose in your body. So a very important process. So the other question about electrical stimulation is what about autonomic dysreflexia? And that is an emergency situation where the autonomic system gets kind of confused. It has some issues in getting the correct messages through. It only develops in the higher level tetraplegic patients. So if you have a lower level, T4 and above is what we usually say. So if you are a person who has autonomic dysreflexia, can FES affect that? Well, yes, it can. Lots of things can stimulate autonomic dysreflexia. Having your bladder too full, having a bowel too full, even wearing too tight of clothes, or sometimes people are so sensitive that just the air current in the room blowing over their body can send them into an autonomic dysreflexic episode. Now, just because you have autonomic dysreflexia does not mean that you will have an episode when you start FES. But you have a much higher chance of having that, so we have to be really prepared for an episode of AD. That's what we refer to it as AD, autonomic dysreflexia. So you have to be very careful about the fact that you might have that. If you have T4 or above, you have to be very aware that even if you've never had autonomic dysreflexia before, that having this input suddenly into your body might trigger it. Now, some people will resolve this over time, and their AD will dissipate as they continue. You can take treatment to reduce your AD. There's oral medications you can take. You can shorten the time starting with the FES and build up over time. And some people that will work, and then for some people they will just have AD every single time. And so that probably would be hampering to continuing in their FES treatment. So there are factors to consider, especially when you're starting FES. You need to be under the care of somebody who really knows what they're doing when they're applying this treatment to you, so that they can be aware. They will know, you're at risk for this, or they will know how to deal with it. Sometimes they can dial back the FES amount of voltage and build up to a higher level. So there are a variety of different things that an experienced practitioner who uses FES will be able to help with, but that doesn't mean that it's going to completely go away, and it doesn't mean that you'll never have it again. We've had people who have done FES for quite some time, never had an autonomic dysreflexic episode, and then all of a sudden just one day they do. So there's all kinds of different factors that play into this. As I say, autonomic dysreflexia is caused from so many factors. And I think a lot of people, when they start their movement exercises for trying to stimulate return of function, they go in their traditional clothes, they go in the shoes that they normally wear, and they don't stop and think that when I'm wearing clothes and shoes and sitting in my chair, they fit me comfortably. But when I'm up and moving, suddenly those clothes might not have the same give to them that they have when you're just sitting. So we have to really examine patients and look at the waist, where the pants are elastic, or where the belt, where the top of the pants come, because as your body is moving, you're going to have a little bit of movement through your torso, and that's going to suddenly rub on clothes that didn't rub before. Your socks might get bunched up in your shoes, or your shoes that fit perfectly fine while you're sitting in your chair. But now if you're doing FES and you're moving your body parts, suddenly maybe your shoes fit differently on your feet, and you're getting a blister on the back of your heel or on your toe, or your socks bunched in there. So when you start FES, you really have to make sure any kind of movement therapy, even if you're standing, if you're going in a standing frame, you have to check your skin very carefully and very frequently to make sure nothing's rubbing, or those comfortable shoes that you've had for a long time suddenly aren't becoming some kind of detriment to your skin health. So there's all kinds of things to look about there. So another question is on pediatric patient. Is it commonplace for children to get FES therapy? And I think Jennifer writes this question, and I think Jennifer and I have had communication before, so I'm happy to see you on the chat today also. And is it commonplace for children to have FES therapy? Yes, it's not at all unusual. It's provided to children just the same way as it's provided to adults. Of course, the systems are slightly different. The voltage that's needed is not as intense because you're trying to stimulate a much smaller muscle, so there are pediatric considerations. And also when we're treating children with FES therapy, it's one thing for an adult to sit for an hour and pedal a bicycle. They're easily able to entertain themselves. They might watch TV, they might read a book, they might do a variety of different activities. It's a good idea while the adults doing FES therapy, if they're visualizing their body moving and how their body's moving and thinking about it, that's also another piece to the treatment. With the pediatric patients, sometimes they don't remember what it was like that when their body moved in a certain way in a walking pattern, or maybe they never walked before in a walking pattern, so they're just learning to do these things for the first time. So creating that entertainment value, I call it, for the pediatric patient is something you really need to think about. if they, can watch their favorite cartoon, or if they can do something to be entertained, because a child does not want to just sit, and just have these electrodes onto their legs and just sit there. They need to have some activity that they are otherwise engaged in. Something that we were trying and seemed to be very successful as an adjunct therapy in pediatrics is if you look online, and probably available in the stores. I just don't shop in the stroller stores very often. But if you look online and look on strollers that have movement for the legs, so they're not healthcare equipment. There's just some strollers out there that people are making that as the parent pushes the strollers, they have like little bicycle feet where the kids can move their legs. And I don't know why the stroller people would invent something like this, but they have. It's not medical equipment. You won't find it in a medical store. But if you have some little ankle foot orthotics that you can put on these little bike pedalers in the stroller, so if your child's small and you go out for a walk in the evening, you can put the AFOs on and attach their feet to this stroller with the bike pedals, and it will give that repetitive motion. It won't provide the electrical stimulation, but it can give that repetitive motion. So as you're just walking in the evening time, or maybe you're taking a walk in the park, one of these strollers you can help just as you're walking along, and the child can pedal the bike. Now you're providing the power as you're pushing the stroller, but the pedal will give that repetitive movement to the feet. So it's kind of a neat thing to do. It's kind of an unusual thing to do. I know when I am out, I don't see these strollers out very much, but I know in my pediatric population, lots of people have them and get them, and they usually buy them over the internet. You have to hunt a little bit, but you just look for a stroller with bike pedals, and they're out there. And again, I don't have any idea why somebody would invent that, but indeed they have. So it's kind of an interesting thing. It kind of gives you an extra little boost. Here again, you want to make sure that you check the skin frequently so that nothing's rubbing up against their skin. If your child has perfectly fitting AFOs that they've had for several weeks and you have no skin problems with them, but now they're attached to a bike and the leg's moving, sometimes you might develop a rubbing spot in there where you think, well, gee, these have never rubbed before. So that's just kind of a different opportunity, but always check, and check again about those kinds of things. Now, there's also FEFs for the upper extremities, so in moving the hands and the fingers. And if you think about your hand and your fingers, think of all those joints in there that have to be moved. So there's FES training that can be used to move those together in one motion, all the fingers together, pulling them together and then stretching them out. There are some FES devices that will move each finger individually. And so there's just a variety of opportunity about that. So there's another question about what other options do I have in restorative therapy. And there certainly is a lot of options that are being available. There is, of course, traditional therapy, and I think that sometimes people are so interested into grabbing on to these very exciting, very technologically advanced therapies that sometimes people forget about range of motion. That's just something to get our bodies going. I mean, when most people get up in the morning, they like to have a good stretch. They're expanding and contracting all their muscles and their joints, and they're moving everything. And so it's a good idea to get started with that in the morning. So, don't forget your basic therapies of range of motion. If you can move your body in any way you want to go through your whole body and give some good range of motion while you're doing range of motion. A lot of times people will move their arms out in front of them. They'll move their arms over to the side, but they forget to move their arms in the back, towards the back of them. So don't forget you have that fourth plane back there, including up and down, front, back, side. Be sure they move in all directions. That's kind of some basic therapy. There's also standing. We consider it an advanced therapy. We consider it an active therapy, but if you can get a hold of a standing frame, and most payers will pay for a standing frame. So it's just a chair that you sit in, and then there's a little pump. Some are electric, some are manual. But there's a little pneumatic pump, so it elevates you into a standing position. Again, you have to be aware you can't just be sitting for a number of years and then expect to stand upright and not have a little bit of blood pressure drop, orthostatic hypotension we call it, in that you need to get your blood pressure such that you're able to tolerate being standing. But standing therapy puts weight in your long bones of your legs, and so that really helps you to build minerals up in your bones so you don't lose a lot of calcium in your bones that way. You can get standing frames that have a reciprocal movement. So if you can move your arms, if you think of one of those Nordic tracks where you move your arms and it moves your legs, well, a standing frame can have that sort of movement also. So that can help with repetitive movement. There certainly is the FES for implants externally, arms, legs, all bladder function, bowel function, sexual function. So there's that component. Aquatic therapy, if you have a chance to get into a therapeutic pool situation. Sometimes you can go to a center where they have aquatic therapy. If you think about being on the water, and if you push yourself through the water, you get quite a bit of resistance. So there's a lot of exercise therapy for resistance because it's really hard to push through water if you're real aggressive with it. However, if you also think about yourself just floating on the water, you have some buoyancy. So if you have just the slightest bit of movement, you can use some aquatic therapy either to develop that movement or even to find that movement. Because you have the buoyancy of the water, you don't have so much resistance of gravity pulling your body down, not wanting it to work. Gravity is sometimes not really our best friend, but we need it nonetheless. So aquatic therapy is certainly another therapy. If you can, the aquatic therapy is better if it's body temperature instead of cold water. And then because cold water makes our muscles contract, so it's very hard to move in cold water, much easier in normal temperature water. And then also there's partial weight supported walking, which is a therapy that is provided in rehabilitation centers where your body is suspended in a harness, so you're only moving part of your body weight. That's why it's called partial weight. And so therapists will either move your legs in a walking motion, or there's equipment that braces that can be put on your leg where you can walk either on a track or treadmill. And then as you get better and better at walking, that more of your body weight can be added on. So there's a lot of exciting therapies going on there's a lot of exciting therapies going on and others that are being developed all the time. So we have a person who who is writing in that is talking about vibration therapy, and they had a atrial venous malformation. That's where the artery changes into the vein. Sometimes there's a little hemorrhage that appears there, and so that can cause quite a bit of trouble. And for this person, they developed a spinal cord injury at T7. So there is a lot of information about vibration therapy. There's a lot of research that has been conducted on that, and there is a lot of positive outcomes with vibration therapy. Most of the positive outcomes are in tandem with other therapies. So this person is asking about a device which is popular in Europe and Germany. It's about $6,000, not covered by insurance. That's quite a little chunk of change. So is this a good therapy? Well, there's been some very positive reports about it. It's been tried out. It's been studied by individuals not connected with the company that developed it. So independent assessments with with positive outcomes, but the positive outcomes seem to be best when it's used with other therapies, such as the vibration while receiving FES, or the vibration therapy while doing some other therapies. So the jury is still out on this therapy also, but I'm glad you brought it up because it is new, and we're talking about ways to increase function. And I don't quite have it on my list. You notice when I went through the therapies, I did not mention it. However, I think in the short term, we will be mentioning this type of therapy as people see more and more possibilities and ways to use this. So this person in particular is having some leg spasms. So now so how will vibration therapy help leg spasms? Well, spasming is this involuntary contraction of the muscle so that it holds tight. And for those who've had spasms, and I think everybody has had some kind of spasm or Charlie horse or something in their life, whether you had a spinal cord injury or not. So if you think about this really bad Charlie horse, okay, so think about now you have a spinal cord injury and these spasms are just continuous and not relenting. You can break a spasm by working the muscle in the opposite direction, and you'll want to talk about to your healthcare professional how to do that because you don't want to harm yourself, but there is a way to break a spasm. You have to have somebody help you with that most usually. At T7 you could probably work, stretch the muscle the opposite direction and probably do that yourself. But spasms are very, very painful if you have that sensation. And so the idea of the vibration therapy is that you use it on that particular muscle or on that whole leg. The muscles become exhausted, so they're not able to spasm. But of course, as the muscle recovers itself, it's going to get into that tight spasming again. So you have to continue on with that. You can't just do it one time and then expect it to be gone, because as the muscle relaxes, builds up its strength again, then it will spasm again. So it's an ongoing therapy is what I'm trying to say. And I should say it in the simplest way. It's an ongoing therapy. So will it work for you? Well, it's a $6,000 gamble because you never know if one device can work for 1,000 people, and by golly, then it doesn't work for one person. If you can get hold of some vibration therapy, there's a lot of places around that now are using it. And so if you can find a facility in your area, you might want to go in and have a one-time session to see how the equipment works. It might not be the exact same brand, but at least you can try out vibration therapy, see how it works, see if it works for you, and then you would be able to better decide if spending $6,000 on a device would be the thing for you. I just hate for somebody to spend that much money on a device and then not have it to be the right treatment. So that would be a good opportunity if you can find a place locally, or even if you have to drive maybe a bit to a place to try one therapy, a vibration therapy, to see how that would work for you. That would be a good opportunity. There's another question about the FES bike that has an option for arms. Yes, that is true. So that is a wonderful opportunity to include arms. in with your therapy while you're using the bike, using your arms, also getting that stimulation to your arms. Now you can buy FES bikes. You can buy FES bikes with adapters for your arms so that your arms are not getting the FES stimulation, but they're actually moving as your body pedals the bike. The arm troughs or splints where your arms are placed will move in the same rhythm as your legs are moving. So that kind of gives you more of a total body workout there. And but then you can also get FES stimulators to help move your arms as you're moving with the bike. So it's quite an opportunity if you can get coverage for that. If you can get coverage for your legs, you can pretty much probably get coverage from your company for the arms. And also the companies that sell these bikes are readily available to help you work with your insurance company, with your health care provider. They have sample letters of medical necessity that can be adapted for your individual needs that can be sent to your insurance company or your payer to request the FES bike payment. So, be sure and work with your health care provider if your insurance is not readily paying for some equipment, any kind of equipment, FES or any other kind of equipment. Be sure and work with your provider who can find a manufacturer of the equipment. All healthcare providers know how to locate providers of equipment. And then those companies have sample letters of medical necessity, which have to be individualized by by your healthcare professional. You will want your healthcare professional to write that letter for you because they know the jargon. They know the important facts that the insurance company will want to hear, and so it's important to work with them. Now, the healthcare provider will send the letter to your insurance company. It's called a letter of medical necessity. The response will not go back to the provider. The response will come to you because you are the owner of the policy. If the owner of the policy is your spouse or your parents, the letter of response from the insurance company will be sent to the owner of the healthcare policy. So you have to be on the lookout for those letters, those responses when they come to your house so that you can get it right to your healthcare provider if they have to write an appeal or if they have to do some kind of follow-up in a certain time frame. So it's very important that all the people work together because if it's sitting at your house for a couple of weeks, it might be too late to respond to the insurance company and they close the case. So you see you have to work very carefully with your health care provider. Okay, there's a sample of a stroller, and I'm not going to click on that link right now, but thank you to Bernadette for looking up the stroller. I'm afraid if I click on the link that I will lose my web page. So I bet that Bernadette has the stroller in hand because I'm sure she knows what I'm talking about. So I'm going to try to look up that link as we go through more questions. There's another question from somebody. How long can you get outpatient therapy? Ooh, that is a very good question because it is different for everybody and who your payer is. So who is providing the insurance, what policy you have, and who your payer is. So okay, what am I talking about? What does all that mean? So when you get insurance, you buy every month that you pay your insurance, you are paying on a particular health care policy. You want to be sure and know what's in your health care policy for rehabilitation care. Somehow I can tell you my health care policy that's provided through my work allows me 2 weeks of rehabilitation care. That's it, 2 weeks. That is the policy that my employer pays for, and so that is all the therapy. If I would have a catastrophic injury, that is all the time I would get. Now, I will just pick out of the air an insurance company, I'm not picking on any insurance company, but say you have a Blue Cross Blue Shield insurance policy, and say your neighbor has a Blue Cross Blue Shield insurance policy. Your policies might be different. Each insurance carrier has a variety of policies, and what they cover is usually based on how much of a premium you're paying every month. So you have to read your policy and know what you're buying every month when you're paying your health care, because when you pay that premium, you're buying your health care insurance. So no matter where you get your health care, if you're buying your policy privately, directly through a health care organization, if you're getting a health care policy through work, you would have to look up your rehabilitation benefits and see what those benefits are. Now, Medicare has a different set of benefits, and Medicare also has different policies available. They have the general Medicare policy. Medicare is for people over age 65, or you can get Medicare if you have been on disability for 2 years. So you can get a policy that is the general Medicare policy, or you can get an HMO policy, which will have different benefits. So you have to really look carefully at what the benefits you are getting. Now, I have a Medicaid policy. That's a federally run program, but it's mandated by each individual state. So I am here in Missouri, so our Medicaid has one set of rules, but we're right across the river from Illinois. So a lot of people from Illinois come to the bigger city, which is here in Missouri, but they have Illinois Medicaid. They have a completely different set of rules that they have to follow. And some Illinois people on Illinois Medicaid cannot come across the Mississippi River to St. Louis to receive treatment that's like 20 minutes away. They instead have to go 6 hours to Chicago to receive treatment. So it all depends on your state and what their state is indicating that you are buying when you get your health care policy. There are some ways that you can kind of work with your case manager through the insurance company to kind of manipulate some of the benefits in your health insurance policy. So if you have a health insurance policy that gives you so many weeks of rehabilitation care, so many weeks of nursing home care, and so many weeks of outpatient care, it's like you have 3 different buckets that you can draw from. You can work with the insurance case manager and say, okay, I'm in rehabilitation care. I am going to go home. My family's set up to take me at home. I'd like to take some of my skilled nursing care, my nursing home benefits, and apply those to my rehabilitation care that I need now. Sometimes you can get those benefits switched in that way. Sometimes you cannot. Sometimes you can take your home health care benefits and move them to a different bucket. It just really depends on what your insurance company, how they work with people, how they have their systems organized. But there are some little caveats within the system. So how long can you get outpatient therapy or inpatient therapy? It's all dictated by how long your payer will allow that. The payers also have rules where they will usually allow you a certain amount of time, and it's different by every company. If you are making progress, they will allow you to stay late a longer amount of time. So it's a week-by-week process where they look at your case every single week, and your healthcare provider has to provide a report to your payer. They review the case, and they will say, you're making progress, you can stay another week. They'll review your case. They'll say, you're not making progress, you have to go home tomorrow. So it's a hard process to navigate, But if you have a good relationship with your healthcare provider, that's what they're there to help you with. There are all kinds of people in outpatient therapy, inpatient therapy. There are case managers that work for insurance, but there are also case managers and social workers that work for the place where you're getting your therapy. So be sure and talk with them. Get to know them. Let them know what your needs are. Let them know what your goals are. They should become your new best friend because they're the people who are really going to be able to help you in that particular way. Okay, there's some more questions about spasticity. And here's a person who has lots of leg spasticity, and they don't take medication for that because it keeps their muscles toned. Is this a bad thing to do? Well, I hear lots and lots of people that do this. Sometimes spasticity can be quite a problem in that it might cause pain. So I think if you're using your spasticity to keep your muscles toned, you probably are not having pain with the spasticity, so we don't have that particular problem. The other thing is with the spasticity, sometimes the spasticity can be so bad that your leg will jerk or kick out or do some other kind of movement. Sometimes people get embarrassed by this, and you really shouldn't. It's just the way that your body's working, but sometimes it can be uncomfortable. It can cause your position in your chair to become misaligned, and so it can cause other problems. But if your spasticity is not such that it's causing you any problems, it's not painful, it's not consistent, the spasticity is working the muscle, and if it's keeping your leg toned, then the muscles are built up. It's actually giving you less of a chance to develop pressure sores or pressure ulcers, because sitting on muscle is a lot better to disperse pressure than sitting on fat. Fat just collapses and causes more pressure. So toned muscles are very helpful. Now the downside of not treating your spasticity is that you're expending an awful lot of energy, and it can be very fatiguing, where just like if you're running a race all day, if your muscles are spasming, it's like running a race all day. So there's always this risk-benefit balance that you have to consider. Some people, if their spasticity is not bothering them, but the medicine to control the spasticity is making them very, very sleepy or making their head feel dull, sometimes that is not a real benefit to the patient, so they prefer the spasticity. So it's the kind of thing that you have to look at for yourself. And then let's see. So there's a question here about the insurance won't cover an FES bike because they consider it exercise and maintenance. What can I do? Well, here's the issue. So yes, a lot of insurance companies will not cover advanced therapies because if an insurance company covers something for one person, they have to provide it for all of their clientele. So if your insurance, and many insurance companies will not cover advanced therapies. Now, the good news is we are getting a great collective body of work of research and evidence that clearly demonstrates the benefits of FES, other advanced therapies, repetitive therapies. It's a great body of work. However, when the buckaroos are up at issue, life is a little bit different. So if your insurance, you've had your healthcare provider write a letter of medical necessity. That's probably your first option. Some people just call their insurance, will you cover an FES bike? Well, no, we won't. Okay. That's not the end of the case. Have your healthcare provider write a letter of medical necessities. The FES companies will provide sample letters so that they will give them a good idea of what they should put in their letter. They can look up some of the evidence and be able to produce scientific evidence research that demonstrates the effectiveness of this. That still does not require your insurance payer to pay for an FES bike because you have purchased a policy that only includes certain things, and probably FES bike was not in it. So another option that you might have is to try other methods of funding. So there are places you can go on the website, on different websites, and just ask the general public, I need this is my condition, I need this piece of equipment. And people, want to donate to things. People are very much in tune to the web, and sometimes people will just supply a certain portion of the money, and you can collect from several people and maybe get enough money to purchase an FES bike yourself. There are other options also. You might form together, if you are seeing a healthcare provider in your community that has several patients who have spinal cord injury, and maybe collectively together you could purchase an FES bike and have it in a clinic or someplace. If you are going to a physician and say they have 10 people who have a spinal cord injury, there are you might go to that physician might work with a rehabilitation hospital. Here I can guarantee you 10 patients that will be using this bike, so they can see how their costs would be recouped through therapy of using this bike, or even a rental system like going to a gym. A lot of rehabilitation hospitals will open their gym in the evening when the patients are not receiving therapy, and you can buy a gym membership at a rehabilitation facility to go in and use their equipment on off hours. One very interesting thing I saw, and it's right here in my community, it had nothing to do with our rehabilitation program or anything, but there was a student at a community college who wanted an FES bike. And the community college had a therapy gym. They also had a health care program, which was probably helpful. So the community college bought an FES bike and opened it up to anybody in the community who had a spinal cord injury to come in, and the students would learn how to, to put people on the FES bike. And the good news was that if you were a student with a spinal cord injury, you could go to that gym for free and use the FES bike. Now, this to me is unheard of, but how fabulous is this? If you work for a big corporation that has a healthcare gym, they might be willing to put an FES bike. They will want to take your picture of you and put it in their newsletter of you using the bike. What the heck? If you're getting free bike use, go ahead and do it. Don't overlook the Lions Club, the Kiwanis, any kind of community club of people. There are a lot of women's clubs that are very interested in philanthropic use. Another very interesting way I heard of somebody getting an FES bike was they started their own business. And one of the things they put in their business plan was that they needed an FES bike to maintain their health so that they could be at their business every day. And then in their business office, they put this FES bike, which while they conducted their business, they just used the bike. And it got funded. So you just never know how these things are going to be funded. It's very interesting to see how all these things work out in the end. So I'm sure that there's a lot of people out there that have a lot of different ideas about funding and how you can get things. So it is very difficult and overwhelming when you first start, but you'll find that there are a lot of people out there that are really interested in helping, especially if you can find a bike maybe through, maybe you could obtain a bike through your church group. A lot of churches, they want outreaches into the community. They might be willing to purchase a bike, but maybe several people have to use it, which is no different than going to any other gym. So there's a lot of opportunity out there. Sometimes it seems very overwhelming to start, but just start asking around. Ask, if you go to any support group, your support group might be able to meet with some organization. And yes, a lot of people are going to turn you down, but eventually you're going to hit upon somebody who's going to say, yes, I will do this. I think as we get more and more collective information, we're going to see FES and other advanced treatments, aquatic therapy, partial weight supported walking, all kinds of therapies are going to become available. And right now, over the last 10 years, the number of therapies available to individuals with spinal cord injury has just skyrocketed. So we're working on a lot different area than we were before. And I see we have a hand raised, so let's go ahead and go ahead and find out what that's all about. And so, Thomas, can anyone hear Thomas? Because if I'm not hearing him.
Brandy, do we have any audio questions?
Again, to ask an audio question, please press star 1.
And Thomas, we see your hand raised. If you if you could type in your question in the chat box if you're not on the phone line or have a microphone to speak into.
Thomas, your line is open.
Hello, Thomas.
Okay, Thomas, if you still have a question, just type in the chat box and hopefully we can get to it. But I know that we're at the top of the 4 o'clock hour, so that might do it for us today, Linda.
Pardon me?
I said we're at the top of the 4 o'clock
hour.
Oh,
yes.
That might do it for us, Thomas.
Okay. Well, and Thomas, if you have a question, just feel free to type into the Nurse Linda blog at any time. And I usually answer pretty quickly. So I don't want to leave without giving you a chance to put your question in there. But other than that, I would just like to thank everyone for joining in today, and I hope we got some thoughts about fundraising. We talked a lot about that, and I know we talked a lot about FES, and I just wanted everyone to be sure and know that, for some individuals, they have a spinal cord injury, that FES will not work, and that the external FES stimulation on the skin is not able to stimulate those nerves and muscles if you have a lower motor neuron injury. However, that does not mean that it will not work for you completely, because there's a lot of development that's going on in the FES world, especially with the study that the big idea that's being sponsored by the Christopher Reeve Paralysis Foundation. And be sure and keep following that, because the developments are coming very, very quickly now. And so there is some treatment for everyone. It just might appear differently, or it might look different, but there is treatment for everyone. So keep that in mind, that there are a variety of therapies out there to help you.
Okay, and I'd like to thank everybody for joining us today, and a reminder that this presentation is being recorded, and to view it at a later date, you can go to christopherreeve.org/webchat. Also, if you have a question at any time for Nurse Linda, please go to christopherreeve.org/nurse and leave your question in our community. Thank you all for joining us today.
Thank you.